Hi, I'm Dr. Chandra Ferrell, and this is my poster presentation for Advanced Care Planning in the African American Church, taking the dis-ease out of the conversation. As noted, the purpose of this project was to improve facilitation of advanced care planning conversations in the African American Church via the development and implementation of an evidence-based program and to evaluate the effects of an evidence-based intervention on the attitudes, specifically self-efficacy and readiness of African American faith leaders as it relates to advanced care planning. Two-thirds of racial and ethnic minorities aged 65 and over have two or more chronic conditions. Compared to their Caucasian counterparts, African Americans are twice as likely to opt for aggressive care and less likely to choose a substitute decision maker, complete an advance directive, or participate in end of life conversations. Barriers between advanced care planning and African Americans include faith in a higher power or God, belief that end of life issues should be managed via religious practices, and lack of knowledge and medical mistrust. As a foundation, I utilize the trans-theoretical model, formerly known as stages of change, and two evidence-based tools. A proposive sampling of African American church leaders participated in a church-based advanced care planning intervention featuring the Institute for Healthcare Improvements, the Conversation Project, specifically the Conversation Ready Toolkit. Inclusion criteria were those 18 years or older, able to read or write English, and those designated by the pastor as a leader. Having been completed across three time points in January and February of 2020, this study consisted of pre-intervention, intervention, and post-intervention phases. The pastor received an abridged version of the intervention, and the leaders participated in the 2-day project occurring on two consecutive Saturdays, 5 hours each. During the intervention phase, leaders self reported via a 15-item advanced care planning engagement survey, which were collected at the beginning of session one or pre test baseline, 1 week later at the beginning of session two, called post test one, and another week later called post test two. Leaders did also receive a $25 gift card at the end of both sessions. Paired t-tests were used to determine significant changes across the three time points: pre-test, baseline, post-test 1, and post-test 2. Level of significance of 0.05 was utilized. For self-efficacy, the Likert scale from 1, meaning not at all, to 5, meaning extremely, was used. Mean scores did increase across all three time points from 3.6 to 4.6 to 4.54 respectively. From pre-test or baseline to the last time point, which was post-test 2, a statistically significant change was noted. For readiness, the Likert scale beginning at 1, I have never thought about it, ending at 5, I have already done it. Mean scores increased across all three time points from 2.73 to 3.48 to 3.59, respectively. From pretest to also baseline to the last time point, which was post-test 2, a statistically significant change was again noted. It is important to mention briefly that the Advanced Care Planning Engagement Survey also used the trans-theoretical or stages of change model as a basis. So when looking at the very bottom in the middle, you'll note that the leaders' mean scores at pretest and baseline were halfway between I thought about it, not ready to do it at pretest, and then moved to post-test 2 to halfway beyond thinking about doing it in the next 3 months. This is indicative of a move from pre-contemplation to contemplation. In conclusion, a brief 2-day intervention utilizing evidence-based conversation-ready toolkit was found successful at improving the attitudes or self-efficacy and readiness of participating faith leaders. Implications for practice are as noted, but especially because of COVID occurring in Chicago right after project implementation, there is some room for revisiting this project, those leaders, and this conversation as well. Thank you for your time and interest in this project.